Hello, and welcome to my presentation on social innovation. Social innovation is all about asking and answering the question, can we make a difference? Well, if your name is Christina Noble and you moved to Vietnam in 1989, there is no question. It can be done. In 1991, she established the Christina Noble Children's Foundation, dedicated to helping disadvantaged children in what was at the time an extremely poor country. In the last 25 years, she's been helping children from all types of areas, including those children who come from poor families. More than 20% of Vietnamese still live in poverty. And don't confuse poverty in Vietnam with poverty in Canada. If you're poor in Vietnam, you're probably going hungry. You don't have access to health care. Maybe not even clean drinking water, and certainly not a good education to help break that cycle of poverty. Rural children. 60% of Vietnamese live in rural areas and don't have easy access to the things we find in big cities and tend to take for granted. Ethnic minorities. Out of 54 ethnic groups in Vietnam, one has an 86% majority, leaving the other 53 as a part of a minority, and in some cases they are treated badly. The kind of help they receive includes things like medical care, bringing out medical professionals to villages, rural areas, taking them to areas where the poor are, and providing low-cost or even free health care where it's needed. Education, providing a decent standard of education for children that otherwise wouldn't have access to it. And community development, not just helping the children, but helping the whole community, providing advice and assistance on things like what crops to grow, overall sanitation in the villages, clean drinking water, all the things a community needs to thrive. Some of the results. Well, in 2013, they sponsored almost 1,100 children to go to school. They were getting an education they would never have had a chance to get otherwise. Provided hundreds of health awareness workshops for parents, especially parents of very young children. They don't always understand because they've never been taught how to care for them. They tend to treat them like little adults, and children need special care. You can't just treat them the same way you would treat an older child. The main source of transportation, especially in rural Vietnam, is still the bicycle, and they gave out 175 of them in 2013. They also provided almost 1,800 free medical services to the poor and rural Vietnamese. And these aren't low-level services. They bring out top professionals, they bring visiting doctors, they bring anybody that can provide a quality medical service to areas where otherwise they're just not available. Regarding this foundation, or even if you'd like to donate, feel free to visit their website, https://www.cncf.org. And as always, thanks for watching.